Hello everyone and welcome to AceOSCE's video for the day. I'm Alicia and thank you again for joining me today. Today I just wanted to discuss about how we have case-based questions that are asked in the evaluating exam. These are usually questions where you have been described one case, usually a patient-centered case, and you are asked multiple questions based on that case as well. So the good part is that you will have a lot of revision for MCQ as well if you go through these cases, because MCQ has a lot of these case-based questions. These can be based on calculations, on law, on pharmacy management, on pharmacology, so any of these topics. So I'm going to show you how to solve one such case and how this could be presented in 1,000 different ways. So today our first question comes out to be for your patient who comes to your refill for your pharmacy for a refill for his atorvastatin. On looking at his file, you see that the doctor had also prescribed clarithromycin for a chest infection. What would be the best course of action? Again, this question could be asked in 1,000 different ways in a bigger sentence with maybe a full patient profile. I will definitely give you such quizzes as well. I just wanted you to have a little bit of an idea of what case-based questions could look like. The first option is going to be refill the atorvastatin for the patient's cholesterol control. This is a drug interaction based question, and you need to have your drug interactions clear. So you know that clarithromycin and atorvastatin don't go well together, because clarithromycin does decrease the metabolism of atorvastatin, causing increased levels of atorvastatin in the blood, which may cause more side effects and higher levels of atorvastatin in the blood than recommended. So refilling the atorvastatin would not be the best option. Number 2, or option B, would be tell the patient he needs to stop taking the antibiotic and keep taking the statin. Now, 2 problems with this one. Stopping the clarithromycin in the middle can, number 1, cause resistance, and number 2, may just treat the infection suboptimally. Not giving a full course is never the good option, so option B doesn't look like a good option either. Now, C would be released a decreased dose of atorvastatin to ensure that he takes both his medications. Now, of course, we do want him to take most of his medications. However, decreasing a dose of a medication is not in the scope of a pharmacist in all provinces of Canada. And PEBC is a centrally administered exam, so anything that has to do with dose changes, drug change, formulation change, in most provinces usually has to be okayed by the doctor before the pharmacist can go ahead with that. So this is more of a gray area, which of course is not a possibility for a pharmacist in most provinces anyway, but this also tests your knowledge about laws of pharmacy and what a pharmacist can and cannot do. So this again is not an option that is even possible. Option number D would be to ask him to hold the atorvastatin until his antibiotic course ends. Now, atorvastatin is a cholesterol controlling medication. Not taking a few doses of it does not induce any symptoms, does not worsen their atherosclerosis or cholesterol levels if he stops it for maybe a couple of days or a few days, which is usually what an antibiotic course looks like. So probably this option suits the best. Again, when you go for the exam, you may see 2 or 3 options that you think are correct. However, they want you to answer the best option. It may be different from what you think. Like your friend may think that option A is the best option, and you may think that option D is the best option. But that is where the PEBC is going to see how you think, what is your process of thinking. So always, if you have 2 or more answers that you think are correct, always pick the best one. The second question is, if atorvastatin is not held for this patient, what could be the implications? Again, 1,000 different ways to ask this question. So read the question carefully. I will be giving you such twisted and turned questions just for your practice. But again, straightforward questions just to get you guys attain to such questions. A would be antibiotic effect may decrease, exacerbating the infection. B would be antibiotic levels may increase, causing higher than usual levels in the body, causing side effects. Option C would be atorvastatin levels in the body increase, impacting liver function. Or D, atorvastatin levels decrease and only give suboptimal cholesterol control. Now, as we did answer in the previous question, clarithromycin and atorvastatin cause an increased level of atorvastatin in the blood, which is why option C in this case seems to be the best option to me. Also, a class side effect of statins is liver impacting. There is a liver impact, especially in patients who have a compromised liver function. They have testing done at regular intervals to make sure the dose and the drug itself are still suitable for them to be having. Therefore, in this case, option number C seems to be the better answer on the best option. One of the other ways that this question could be framed would be the patient comes in, forgets to take your recommendation on whatever answer you give in the first part. What are the side effects or what are the concerns he may present you with? So, another quick way of presenting this question. The third question based on this case would be, which of the following enzymes do the statins work on to help maintain cholesterol control? Now, as most of us know, statins fall under a class of medications called HMG coenzyme A reductase inhibitors. HMG coenzyme A reductase is an enzyme that is found usually in the liver, which helps in the synthesis of cholesterol. Now, statins usually work on those by inhibiting this and help in maintaining cholesterol, which is why option number B, I think, is the right answer. All the others are enzymes that may or may not be found in the liver, but are not enzymes that statins work on. Just to give you guys an FYI, HMG coenzyme A reductase is usually most active in the evenings, which is why giving cholesterol medications, especially statins, are recommended to be given in the evening, so that the most impact or the most efficiency can be taken out of the medication. The last question based on this case would be, which of the following would be a class side effect of statins? Again, a very straightforward question. What I gave you would come in 1,000 different ways, especially where you have a patient and their drug profile with 10 different medications. So which of the following can be implicated to the use of statins, right? So the options here are muscle aches, diarrhea, tachycardia, or drowsiness. In this case, the options can also be given way wider. For example, what of the following can be attributed to side effects of statins? Option number A, instead of muscle aches, could be the patient comes in complaining of having back pain, especially when he goes out running or exercises. Option number B could be presented as having an upset stomach even though he takes his medications with food, like diarrhea. So be sure that you also read the options very carefully. Again, I will be discussing these in my discussion classes, just so you guys know. To answer this question, option A, which is muscle aches, is a known class side effect. So just wanted to go over this quick question with you for a revision today. Many mock tests. I have opened up more slots. Thank you so much, guys, for enrolling with me. A few of you have, and I'm excited for this because I know that this will help most of you at least gauge if you're ready or not for the PEBC evaluating exam. And if you feel you're not, that's okay, because you still have a lot of time to prepare. For those of you who are still studying, this will probably tell you which areas you want to study a little bit more on or concentrate a little bit more on. And people who think that they have already studied and are just in the revision phase, it will help you in the post-exam or post-test discussion classes, where you could discuss and give your answers and feedback to other people who maybe are still just getting on with the study phase of their exam. So I have opened up multiple dates for it. For now, I think it was March 7th, Friday at 2 p.m., 2:30. I've also opened March 7th, Tuesday. And as always, keep an eye out for my posts on our group. I keep on putting on more and more questions as I keep coming across from them. I am hoping to do many more mini mock tests in the future, especially if you guys find it helpful. And I appreciate you guys answering and engaging in the groups, especially for those people who don't only give the option as the answer, but also give a little bit more information about the answer that helps other people to understand the answers as well. Again, thank you for joining me for this video, and stay tuned for more.